Hi there. My name is Ted, as Mary said, and I live in Edmonton, Alberta. And I was diagnosed in 2019. So it came as quite a surprise, as many of you have probably gone through that. We live on the south side of the city. We run a small business, my wife and I, and I've got 3 grown kids, and they're all out of the nest. But they all live nearby in the city, so it's great to have them nearby for me as we go through this. I want to give you a little background, is kind of just describe. Mary suggested I just go through my experience and how it came to be, and what I've learned as I've gone through this over the last 30 months, and I'm happy to do that. My diagnosis came actually because my optometrist was doing an eye scan, and he saw something and he flagged it, and immediately referred me to an ophthalmologist. And I got in really quickly, which made me a little nervous that I got in so quickly. And I got attention, and he flagged me and sent me down to Calgary to see the oncologist. In Alberta, that's Dr. Weiss. And that all took about 3 weeks. And then Dr. Weiss sat me down. My wife was there and gave me the diagnosis that I had a uveal melanoma. I had no idea what a uvea was, and I didn't know anything about melanoma. So it came as a heck of a shock. My wife and I were scheduled to go on a holiday down south, and Dr. Weiss suggested that wouldn't be a good idea. That fortunately there was a opening for me in 2 weeks for surgery at the Cross Cancer for treatment. And the great thing is that there was quick treatment, quick diagnosis, and a quick referral. That was really reassuring, but at the same time, it sure comes as a heck of a surprise that someone tells you have cancer and it's in your eye, and it's really serious, and they're going to stick something in your eye to give put radiation treatment into your eye. So lots of discomfort around that. But I soon realized, after doing some reading and some of the information that the doctor gave me, was that uveal melanoma has been around and been known for years and years. I mean, 70, 80, 90 years they've known about it and been able to identify it and treat it. So there's a lot of knowledge and information and professional dedication that's gone into the treatments. The treatments have all changed, because originally most of it was what they call enucleation, which really is a fancy word for they removed your eye and put in a glass eye, and that was and then hope for the best. So the treatment is far, far better now. The main treatment, for my case anyway, is radiation treatment, which is called brachytherapy or plaque treatment. So they literally put seeds of radiation into a small cap. The surgery took place on a Monday. They put you under anesthetic, and they do a surgery on your eye where they literally sew on this small cap of radiation onto the back of your eye and send you home for the week. So Monday, Tuesday, Wednesday, Thursday, Friday, it's pretty uncomfortable. You've got a patch on your eye, and obviously not doing too much. And then come back on Friday again. They put you under anesthetic. They reverse everything they did on the Monday, take it out, send you home with some painkillers for another week. That's when the discomfort really started. When they take it out, your eye is extraordinarily uncomfortable. Feels like there's sand or gravel in your eye, and obviously you're bruised up and there's some pain. But really, every day that went by, it got better and better and better. And at the end of a week of recuperation, my patch came off, and I went back to work. And I've been back to work ever since. And I've really had no complications at all. I'm feeling really fortunate that way, that it's all worked out. That's not to say that there isn't some follow-up. There is, and I'll talk about that in a second. But I just want to reassure people that certainly in Western Canada, and I'm sure the treatment in out of Ontario is the same. Dr. Weiss and his team are really professional. They're very knowledgeable, very organized. I was referred very quickly over to the Cross Cancer. They did a good job of introducing everything to me, and all the appointments got set up. Everybody was on time, and I have to say, living in Edmonton, it was a day patient. I was in and out one day and in and out the next day, and all my treatments and follow-up have been fairly easy that way. I now go to the Royal Alec Eye Clinic every 90 days. The doctor is there. He travels back and forth from Calgary constantly. Very grateful for that, to have access here in Northern Alberta, that service. The follow-up treatment that comes after the radiation treatment is every 90 days. So it's been 2.5 years. It's every 90 days. It's all scheduled and set up. And I go into the eye clinic. They take pictures. They take eye tests. They do ultrasounds of my eye. And then I, sit down every time with Dr. Weiss. He makes sure that things are proceeding well, and for me, they're proceeding really well. The tumors died and shrinking and going away. I get an injection every 90 days in my eye of something called Avastin. I understand that it helps with the control of blood vessels. And if that sounds intimidating, it is intimidating. Somebody sticking a needle in your eye, and the first time it certainly was. But the doctor is super skilled at it. It's relatively simple now. So it's bad the first time, and the follow-up ones are okay. I'm also have had a few treatments of laser into the eye. Dr. Weiss does that as well. I understand that is for getting around the edges of the tumor, and again, making sure that there's no growth around the outside, nothing growing back into it to supply blood into the tumor. So he's really happy with my progress. It's been exactly textbook. So thank goodness for that. My eyesight, it was my right eye was the problem. And as you can see, I've got glasses, so my eyesight was never perfect. And it's the good news, it hasn't changed. It's no worse. It hasn't got any better, but it's certainly no worse. And I've been told that it would get worse, and I would have some problems. And I'm fortunate at 30 months that I don't. So I'm thankful for that. But again, it probably will get worse. But with the other eye compensating, I really should be fine, and not anticipating a lot of changes that way. The other follow-up that you get, of course, is for metastasis. You don't want this thing to spread, and so in Alberta, the regimen is once a year to do some follow-up scans to see if it shows up anywhere. This cancer typically shows up and presents itself, if it does at all. It does in the lungs and in the liver. And so the annual scans are chest x-ray, liver ultrasound, and some blood work. And of all the things out of this treatment, this is the one that actually kind of bugs me the most, because for a year you kind of forget about it. And then as the scan time comes in, for me it's January, about a month before you start thinking about it, and you get the scans and different ones on different days, and you wait for all the results, and they all come back negative, and then you feel good for another year. But I think they call it scanxiety, and I didn't know what it was, but now I do know what it is. It's anxiety around your scan results. I can't say enough about the way Dr. Weiss and his team have taken care of me. The treatment's been very, very, very professional. It's given me a lot of confidence. If I can give folks a few tips that I've learned in the 30 months that I've been doing this, I guess I would suggest that have a lot of confidence in your treatment. And I think in Canada, both the groups that are doing it, mostly in Canada, are lots and lots of experience. And my understanding is that they're world class. No one in the world is doing it any better than we're getting it right here. So I'm thankful for that. And if you're going through this, you should have a lot of confidence in your team. For me, being able to talk to a few people about cancer, I didn't post it and spread it on the internet, but I certainly did reach out to friends and family and brothers and sisters, and it was so good to have my wife and all my family supporting me, and for me, it made it quite a difference to be able to talk to people, and I didn't realize how many people have been touched by cancer until you start talking about it, and then you get a lot of support back, and it really actually feels great. And I thank all of those folks for the support through this. A word of caution, I guess. I made a note here. If you're diagnosed and you go online and you feel there's an awful lot of information online as usual, and the word of caution is watch the dates. The age of a lot of these documents and reports are 15 and 20 and 30 years old. Some of the data that's fed into these reports are way old and out of date, and they can be a bit scary, and then you realize some of them are really old and the results are better. So be cautious what you read online. I find the best reference has always been Dr. Weiss. He's told me not to worry about it, so I don't as much as I used to as time goes by. I've learned to appreciate life a little bit more and live in the present. So I guess maybe that's a side benefit of having gone through this, and again, thankful for that as well. Mary, I'm happy to stay online as long as I need to and answer questions for as long as anyone has any questions throughout the seminar or after the seminar. I'll stick to the end. So thanks very much. I hope my comments were helpful for everybody. Did I actually develop a retinopathy? And no, I didn't. It wasn't as a result of something happening to my eye. It was more done as a protocol to help eliminate blood vessel growth. And Dr. Weiss says that's what it's done. The other treatment I got was the laser treatment, which literally is a laser attached to the front of your eye, and Dr. Weiss puts on goggles and plays a video game shooting lasers into your eyeball, which it doesn't hurt at all, actually. You don't even hardly notice it. It's the next day when it's a little bit more sore. So that was something that was a bit unusual for sure. The question is, how was my comfort level during my plaque week? During the week, certainly it was sore. They put a patch on me, sent me home the same day. And so it's tender, but it's uncomfortable. I wouldn't say there was a lot of pain associated with it. I was on some moderate painkillers. I didn't really need too much. The most discomfort was after it was taken out. That's when the eye is really raw and kind of feels like there's sand in your eye. It's quite uncomfortable for a few days until it settles down. Absolutely no. I had no symptoms at all. I was totally shocked when I got that diagnosis. The optometrist had taken pictures of my eye before, and he did note it before and noted it as a freckle, or kind of like a freckle. And he said, we probably will keep an eye on that. And it was at a subsequent picture that he decided that it had grown. And I guess that's one of the keys is when one of these things, they can be a freckle, and most of them are freckles. And my understanding is that most people have some in your eye, and most of them are just, they never come to be anything. It's when they suddenly start to grow that is the key. So that's what he flagged me on for that. But I didn't experience any eyesight issue. I didn't experience any pain issue. I do understand that some people do. I think maybe that probably comes if they're more advanced, or they haven't been spotted, or you haven't had an eye scan for a long time. I guess I'm a big believer now in eye scans. Everybody should get them done because it's pretty much the only way they can be spotted.